Welcome to Eggs and Issues, a monthly business program presented by the Portland Community Chamber, with presenting sponsors Bank of America, Martins Point Healthcare, and WEX. In cooperation with IDEXX Laboratories, Harvard Pilgrim Healthcare, and Oxford Networks. And television sponsor WMTW News 8, with production support by Headlight Audio Visual. And now, please welcome the Portland Community Chamber President, Bill Becker of Key Private Bank.
Good morning and welcome to Eggs and Issues. This is the Portland Community Chamber's monthly business forum where we gather to discuss business issues of the day. I am Bill Becker, Vice President, Key Private Bank, and also the volunteer president of the Portland Community Chamber of Commerce. It's great to have you all with us today. Our special guest this morning is Mary Mayhew, Commissioner of the Maine Department of Health and Human Services. She will discuss the growth and enrollment in Medicaid, the rising costs of the program, and the loss of federal funds. She will outline the areas of concern, the challenges the program faces, and the initiatives being taken to create accountability, effectiveness, and efficiency. She will also explain why Maine is not expanding Medicaid under the federal government's Affordable Care Act. As we do each month, I'd like to offer a few words about our sponsors. Our program is made possible through the generous support of our sponsors, all of them leaders in the greater Portland business community. Please hold your applause until I have mentioned all of them. Presenting sponsors, Bank of America, Martins Point Healthcare, and WEX. Cooperating sponsors, Harvard Pilgrim Healthcare, IDEXX, and Oxford Networks. Reception sponsors, Clark Insurance and Key Bank. Overall production support of Eggs and Issues is provided by Headlight Audio Visual, and our program is broadcast by our friends at Time Warner Cable's on-demand channels 1, 950, or 1040. Our print sponsor is The Forecaster, and our e-media sponsor is Maine Biz. Our radio sponsor is WGAN, who interview our speakers and broadcast live right here every month, and our broadcast partner is WMTW TV. We also thank our special community partners, Anthem Blue Cross and Blue Shield, Northeast Delta Dental, and the Portland Press Herald, Maine Sunday Telegram, pressherald.com. Now please join me in thanking all of our sponsors for their generous support of Eggs and Issues. Our Tomorrow's Leaders program allows high school students to attend Eggs and Issues during their academic year. We'd like to thank our sponsors AAA of Northern New England and Springborn Staffing for their support of this program. We would like to welcome many students to our event this morning. With us, we have students from Falmouth, Portland, Cheverus, and Catherine McCauley High Schools. Students, would you please stand and be recognized? We also would like to thank Springborn Staffing and AAA Northern New England for their support of our program, Tomorrow's Entrepreneurs. This program allows students from Southern Maine Community College's Entrepreneur Program to attend Eggs and Issues for free. Please welcome students and faculty from SMCC. Baker Newman Noyes sponsors our Community Corner program, which allows area nonprofits to promote their organizations at Eggs and Issues. Our Community Corner partner this morning is Camp Susan Curtis. Camp Susan Curtis is a privately funded Maine nonprofit 501c3 with a mission to build the character, self-confidence, and self-esteem of economically disadvantaged Maine children through tuition-free, high-quality educational, camping, and social experiences. Camp Susan Curtis is funded through corporate gifts, private and corporate foundations, and generous gifts of groups and individuals who believe that every child matters to the future of Maine. At Camp Susan Curtis, positive adult role models teach 21st century competencies to more than 500 vulnerable Maine boys and girls each year. Children ages 8 to 17 are removed from everyday stress and challenge of economic disadvantage and, through transformative learning, broaden their overall capacity to learn while creating a permanent foundation for lifelong achievement. This transformation induces a paradigm shift where children of generational poverty approach life and learning through a lens of promise and potential, redefining their futures and the future of Maine. With us today from Camp Susan Curtis are Melissa Silly, Executive Director, and trustees Pam Joy, Mike Sullivan, Bob Dunphy, and myself, all trustees of the Kemp Susan Curtis Foundation. Please join me in welcoming and recognizing our guests. Now we want to take the time to recognize any new chamber members who are with us this morning. On the screens, you can see the number of new members that we've had join in the last 30 days. Our ranks continue to grow, and we are very pleased. New members, would you please stand to be recognized? Welcome. We're glad to have you here. We're also proud to welcome members of our Portland Veterans Network, our comprehensive free program for unemployed and student veterans, focusing on jobs, wellness, educational, and networking opportunities. We would like to extend a special thank you to Easter Seals of Maine, who has partnered with the Chamber to maintain and promote the Veterans Support Network. Welcome, veterans. Thank you. I'd like to take just a few moments to talk about a serious note. On behalf of the Portland Community Chamber's Board of Directors, I'd like to update you on our efforts to get the Pirates back playing at the Civic Center. Despite our best efforts, we have not yet been successful at getting the two sides back to the negotiating table. The Pirates have agreed and would have suspended their litigation in a good faith effort to reach a deal. The Civic Center trustees declined to participate. The Chamber has two specific concerns. First is repayment of the bond. 3 years ago, the Chamber endorsed the $34 million referendum campaign to renovate the Civic Center. Part of our endorsement was due to the partnership of both the Civic Center and the Pirates, and the fact that the campaign was promoted to the public with the Pirates as the anchor tenant, all part of the financial model to finance the debt. If the Pirates are not going to play at the Civic Center, we'd like to know the trustees' plan B. How do they plan to generate enough income to pay back the bond? The 24 home games that the Pirates canceled are still blanks on the Civic Center calendar. I don't think it would be with 6 to 12 games from a yet-to-be-formed indoor lacrosse league that may or may not be playing there. The burden will eventually rest on the backs of the Cumberland County taxpayers. It is a general obligation bond, and the towns in Cumberland County will be taxed to fund the debt if the Civic Center can't come up with enough revenue. Second is economic impact. Chamber members have already felt the impact of the Civic Center being closed for renovation, and they will surely feel the absence of the Pirates as early as January, when the Pirates were supposed to come back to play. Annually, the Pirates' home games generate between $4 to $5 million annually in economic activity to local businesses. That's about $100,000 for each of their approximately 50 home games. Let me give you a comparison. If a cruise ship brings 1,500 passengers, each spending $80, then each missed Pirates game is equal to a missed cruise ship call. Imagine if 25 cruise ships canceled due to a lease flap. The Pirates games are an economic driver in Portland, and without them, we all lose. We're not picking sides in this battle. Instead, we are representing the Chamber members' economic interest by continuing to push for resolution of the remaining issues on the lease deal. They're not that far apart. We also want to know how the Civic Center will repay the debt without a serious anchor tenant that impacts all taxpayers in Cumberland County. What is the Civic Center's alternative plan? We will continue to pressure both sides to reach a deal and to sign a lease, even a one-year lease, that benefits Portland and the region over the next 2 weeks. You can expect to hear more from the Chamber on this issue. Now I'm also inviting your personal help. There are 9 trustees on the Civic Center board. There are currently 4 vacancies that board is looking to fill by the end of the year. Any Cumberland County resident can apply. I'm hoping that 4 people in this room are the next 4 new trustees of the Civic Center. On each table, you'll find the notice of the application to be a Civic Center trustee. Applications can be obtained through the Cumberland County Executive Office. Now, they need to be returned by noon on Friday. Please call, get an application, and consider submitting your name to join the board. It would be of great benefit to our community. The terms begin on January 1st. There's 1 meeting each month. If we want change, we need to create it ourselves. Get an application, join the board. You'll be a hero. We'll give you free eggs and issues for a year. And now on to our speaker. Following Mary's remarks, we will have a question and answer session. For this portion of the event, please use the microphone closest to pose your question. Please introduce yourself and tell us the name of your company or organization, and please be brief and succinct. As Commissioner of the Department of Health and Human Services, Commissioner Mayhew provides leadership, guidance, and policy direction to an organization with an annual budget of more than $3.4 billion and more than 3,000 employees. Before being appointed Commissioner by Governor Paul LePage, Ms. Mayhew served for a brief time as the Senior Health Policy Advisor for the administration. Previously, Mary served as Vice President of the Maine Hospital Association for 11 years. There, she was responsible for state and federal government relations and development and advocacy of the association's healthcare policies. Prior to joining the Hospital Association, Ms. Mayhew was a partner in the public affairs firm of Hawks & Mayhew, based in Augusta, providing association management, public relations, and advocacy services to a variety of clients. DHHS serves approximately 1/3 of the people of Maine, providing health and social services support to children, families, the elderly, the disabled, people with mental illness or substance abuse, and the poor. The department operates 2 state psychiatric hospitals, provides public health information, guidance and management through the Maine Center for Disease Control and Prevention, and provides oversight to hospitals, nursing homes, and other healthcare entities through the Division of Licensing and Regulatory Services. Mary works tirelessly for the people who she serves and the staff that she leads. We're fortunate to have her with us today. Please join me in welcoming Commissioner Mary Mayhew.
Good morning. So happy to be here. Nice opportunity to provide a more in-depth view of the Department of Health and Human Services. And as Bill said, it's a $3.4 billion annual budget, more than 3,400 employees. I was often asked, certainly early on, but frankly it seems about every day, so how do you do it? Literally, how do you do it with the challenges you face and the magnitude of the department's mission? And I want to emphasize, I think what is certainly challenging about the department is its size, but what is also such an incredible opportunity is its size. It is the breadth of the mission of this department that we can look at opportunities to provide more comprehensive services for the individuals and families that we serve, to look at ways to provide more effective and integrated services to truly help people achieve their personal goals. As part of the governor's cabinet, I have enjoyed working with the rest of the LePage administration as we work to move Maine forward. The leadership team has worked together to achieve some very important reforms in the past 3 years, lowering taxes, creating jobs, addressing rising energy costs, and making improvements in education have been key focus areas of the LePage administration and will continue to be in the coming year. What I would like to focus in on today is giving you a look into our work at the Department of Health and Human Services and the reforms we have achieved running the state's public assistance and welfare programs. The governor and our department share a clear vision for the future of these programs. We need a department that is accountable, cost-effective, and efficient, and is delivering high-quality programs and services focused on the needs of the individual and doesn't force people into a siloed, one-size-fits-all program that doesn't effectively address their health and their social needs. The department must align its resources, our limited resources. We're doing more with less, to ensure that we are providing a safety net of services that provide an integrated approach to the resources individuals and families need. As you can imagine, the individuals and the families that we serve don't fit neatly into one program area. Their needs span across multiple programs in the department. And I'm sure it won't surprise you, like any large organization, this isn't unique to DHHS or to state government, we have silos. Some of those silos have developed for a variety of reasons, but certainly federal agency strings through funding resources have created these silos that have not worked in the best interests of individuals and families as we look again to provide a more holistic approach to meeting their needs. The vision we have is for a person-centered system that is effective and efficient and focuses on moving people towards improved health, employment, self-sufficiency, the ability to support themselves and their families. Welfare programs shouldn't be the goal or finish line for those who need assistance. We need programs that are effective and integrated, that are proven to support people on a pathway to employment and self-sufficiency. Truly an effort to end generational poverty. While I'm going to spend the vast majority of my time today talking about the Medicaid program, I simply want to start with another example of an initiative we've taken on in the Department of Health and Human Services that really exemplifies the governor's commitment to creating that successful pathway for the families who depend on the department. It pertains to our vision to transform the Temporary Assistance for Needy Families program. We are aggressively moving away from strictly a cash benefit and a limitations-based approach. What are all the reasons you can't work? 2, supporting infrastructure designed to support education, training, and employment that is founded on a strengths-based approach. What can you do? Today, we have put in place time limits to help incentivize individuals to move towards long-term employment. To work towards this goal, each and every recipient of TANF will receive a vocational assessment to not only look at their interests, their career pursuits, but also to better understand what are the barriers to their success, to identify where other resources are needed related to substance abuse, mental health services. Additionally, we have formed a partnership among the Department of Labor and the Department of Education to look again across our 3 agencies at how we can better support aligning our resources and our programs to more effectively serve these individuals. Those ready to work will be on a fast track to a steady job and a transition off of welfare. Those who need training and education will be asked to dive right in and get the training they need to be job ready. Along the way, we will help support their process to self-sufficiency and a job and a career they can be proud of. This is consistent with Governor LePage's vision that the department's role should be to provide critical supports and resources to assist individuals and families with their goals of supporting themselves and their families. These types of reforms are happening throughout the department. We have a laser beam focus on making sure our limited resources are used thoughtfully and always with an eye toward helping individuals and families transition to independence. There are many programs within the department, but today I am going to focus on the largest program, our Maine Care, the state's Medicaid program. I want to address a few things about Maine Care, how we got here, what are the hot spots, cost drivers within the program, what we are doing to address those cost drivers, and what really needs to be the focus for this program long term. And as Bill indicated, I do intend to speak specifically about why this administration is not in support of the Medicaid expansion under the Affordable Care Act. As you can see from this graph, on the federal level, Medicare and Medicaid have grown significantly and are major cost drivers in the federal budget, with substantial increases expected over the next several years. Similarly, it won't be surprising to you to hear that enrollment and costs in Maine's Medicaid program have grown dramatically over the last decade. As you look at the enrollment in the Medicaid program, it has more than doubled in the last decade. In 2000, there were just over 160,000 individuals enrolled in Medicaid. Today, enrollment in Medicaid exceeds 320,000 individuals. 1 of every 4 Maine people is on the Medicaid program. As you would expect with increased enrollment, our costs have also similarly increased. The cost of running Medicaid in Maine has increased by $1.2 billion since 2000. $1.2 billion. The program has doubled. We have an annual budget today of $2.5 billion. To put this in perspective, Maine's total annual budget, including federal funds, is $7.4 billion. We understand that there is a real need for assistance in our state. We work every single day with families across Maine that have extreme health needs, and we recognize that some program growth is a result of an increase in those needs. But this explosion in cost and enrollment is unsustainable. The program is growing too fast, and without reform and change, it is simply not sustainable. For more than a decade, the Maine Care program has been in a state of financial crisis, with annual shortfalls in the tens of millions of dollars and millions in unpaid bills. It is simply impossible to make good, informed decisions and to plan for the future of this program when it is perpetually suffering from financial challenges because the growth in the program outpaced the budget. We need a Maine Care program that is not reeling from one financial crisis to the next and is unable to look out past 6 months. When you think about our rapidly aging demographic and the demand on our system, and specifically on Medicaid, we have got to build a budget and a program that is able to anticipate and plan for that increased demand on services. Most recently, the financial foundation for the Maine Care program has been struggling to recover from the disappearance of the temporary increase in federal Medicaid funds through the American Recovery and Reinvestment Act, which ended in June 2011. Maine benefited by more than $600 million in temporary federal Medicaid funding over 3 years. It was used to plug gaping holes in the Medicaid budget. And when that funding went away, the additional cost to support the program fell firmly on the state budget. So to put this in perspective, while overall Medicaid spending from state fiscal year 11 to 12 increased less than 2%, Maine needed to increase its state spending to support the program by 48%. Overall Medicaid spending increased less than 2%. The state had to come up with $250 million, a 48% increase, in order to sustain the program. That's a structural gap in the program that we are continuing to struggle with. There are more temporary federal rates that are scheduled to expire. I'm going to talk a little bit about our Health Homes initiative, which is also funded today with a temporary increase, but primary care physicians, through the Affordable Care Act, were given a temporary increase in Medicaid reimbursement. That expires a year from January. Those are additional pressures that we need to be planning for in order to continue to support primary care physicians. What is equally important when you think about the growth of the Medicaid program, and as I just described, the increasing demand for general fund, state general fund dollars to support the program, is its impact on the rest of state government. So as you can see from this slide, we have seen a significant growth in Medicaid's percentage of the overall state budget, now accounting for 25% of all general fund spending. It simply is going to compete and take away from other state priorities. It is the context within which we have got to make state decisions. What is the impact on transportation, on education, on public safety? And for the Department of Health and Human Services, if we are trying to shore up and deal with the challenges, the financial challenges in Medicaid, that is also detracting from the ability to support other 100% state-funded programs, child welfare, mental health services, public health programs. It is a matter of understanding the competing priorities and our limited resources. This slide, I know it's probably difficult to read, but just to underscore, as you look at the overall growth, dollar growth in the state costs associated with the Medicaid program. You don't add $1 billion to a program without some major hotspots or cost drivers. Certainly enrollment has contributed to our costs. We have added individuals to the programs, and as you would expect, that has driven up costs. But what our analysis shows is that there is a particular group of individuals that account for the majority of our program costs. This seems reasonable and frankly is consistent with Medicare, other commercial payers. But what I want to highlight, 5% of our Maine Care members, 5% of our members account for 54% of the total spending in the Medicaid program. Just 5% represent more than half, nearly half of our overall spending in the program. This breaks it down even further across all of the population served by Medicaid. So 20% of our Maine Care members account for 84% of all of the program's expenditures. And when you look at the cost per member on an annual basis, you can see as well significant difference between the top 5% annual costs per member in excess of $68,000, while the annual cost for the 80% of our members is closer to $900. Now, it's important to know who these individuals are in our top 20% and our top 5%. We're talking about those who most depend on our programs and services. These are our elderly, our frail elderly. These are individuals with intellectual and developmental disabilities, people with physical disabilities, with complex medical needs, need for 24/7 residential and facility care. These are the vulnerable populations that we need to understand how our resources can best be aligned to support their needs. In many cases, these are individuals in facilities where their total costs, including room and board, are covered by Medicaid. This administration is working to ensure that we are serving these individuals in the most appropriate setting, in home and community-based settings where resources are aligned to best support their needs. There are many elements of our work in the long-term services and supports that can help to ensure more effective use of our resources to best serve those who are most vulnerable. These are areas that affect the entire healthcare delivery system. There's certainly areas that we're focused on in Medicaid, trying to understand as we build reforms what the drivers are that we need to be effectively addressing. Clearly, we still struggle, as the entire healthcare system does, with a volume-based payment structure. We pay for the number of services, the number of units. We have not yet transformed the system and moved to a outcomes-based payment structure to reward for high-quality outcomes, for improved health status. Medicaid absolutely has to move in that direction so that we can assure that the services that we are purchasing on behalf of our members are actually leading to improved health outcomes and improved health status. In recent years, we have certainly seen an uptick in the number of people enrolled on the program who are utilizing services, and those who do are using more. So even as we look to address increasing enrollment, increasing utilization continues to drive up our costs. This is also a result of fractured services with little coordination. Healthcare costs in general continue to climb as well. According to a study from the Journal of the American Medical Association recently released, U.S. spending on healthcare in relation to the GDP has doubled since 1980 and continues to outpace growth in other industries as well as GDP. Another key area of concern that I've mentioned that we are focused on is long-term care. With a rapidly aging demographic, the Medicaid program must be prepared to meet the increasing demand for services with a delivery system that is best equipped to support people in their homes, in communities, as well as meeting the need for 24/7 residential and nursing facility care. In fact, when I mentioned the high five group, our top 5%, 71% utilize long-term services and supports. 26% of that 5% are in nursing facilities. How we respond to the challenge of our aging state will go a long way towards building a sustainable Medicaid program. While the challenges are daunting, Governor LePage and this administration are tackling them head on. I want to talk to you about a few key examples that have made a difference in addressing these cost drivers. Another area, in addition to our top 5%, are our high utilizers. We have individuals, for a host of reasons, who cannot get timely access, appropriate access to primary care services. They are using the emergency department as their point of entry into the healthcare system. They are overutilizing the emergency department, and again, it is our job to better understand what is contributing to that inappropriate use of the emergency department. We pulled together a team to begin looking at, on an individualized basis, what the contributing factors are to that use of the emergency department. It started with a small pilot project. We have expanded that project to all of the hospitals in the state where we are identifying their high ED utilizers, creating a team-based approach with the hospital, with their care managers, with other community providers to go case by case in the best interests of those individuals to help identify the resources that can best assure that they have needed access in the community to improve their health and their condition. We have seen tremendous success from this initiative. We saved more than $8 million in the last budget, and again, more importantly, We are helping people improve their health. And it is about investing in the individualized approach to understanding the complexities. And for many of these individuals, I'm sure you can appreciate, it is not simply a medical challenge, but medical and social. And how well we do in merging both those medical and social needs and addressing those is what will lead to success. We work hand in hand with doctors and other community providers to ensure that individuals receive appropriate treatment in the right setting. We are prepared to move on beyond this program to now start to look at high inpatient utilizers, again with the same focus on an individualized case management approach. A broader initiative that we are focused on is that investment in primary care to address inappropriate or avoidable hospital utilization, ED utilization. We need to have a structure in this state that is supporting access to primary care, that is creating an integrated approach to both primary care and behavioral health. We have established a health homes initiative that is as a result of the Affordable Care Act. We get enhanced payment. It expires 2 years or a year from this January. The governor feels strongly about this investment in local infrastructure. We know that the true opportunity to impact health, to create needed change in the system needs to occur locally. We wanted to effectively partner with community providers. It's why we felt so strongly about the Health Homes Initiative, to create this more integrated, holistic approach, again, both to primary care and behavioral health. We have more than 150 health home practices focused on improved health and reduced inappropriate utilization in the system. One of the other areas, as we look to hold providers throughout the state accountable, it is imperative that the Department of Health and Human Services adheres to that same standard of accountability. I mentioned to you, we're siloed. We don't have the best track record of an integrated approach, a holistic approach to the individuals and families we serve. We started a project recently in the department of bringing a representative from all of our programs together to begin to look at some of our cases, again, spanning across many of the programs. We identified families that had 2 or more members of their family that each had medical expenses exceeding $10,000. We then looked at other programs that they were receiving resources, came together as a team to understand how can we make sure that the services we're providing are meeting the needs of that individual, that family, and helping to improve their health. We're transitioning it to a pilot program in our Lewiston district office, again, to make the Department of Health and Human Services an effective partner with the community, that we can provide a warm handoff to our community providers because of our knowledge and understanding of their case and the services they need, both medical and social. So let me turn to expansion. We have spent considerable time analyzing expansion. There are significant reasons why the governor and I feel so strongly that the state simply cannot afford to expand the Medicaid program. In Maine, this would mean tens of thousands more individuals on Medicaid, all of whom are non-disabled adults. For me, this expansion starts with a reality test. It's very hard to believe, after going through sequestration, the across-the-board cuts by the federal government, the recent federal shutdown and the debt ceiling debate, that the federal dollars promised will be there down the road. This insatiable appetite for federal dollars, and specifically federal Medicaid dollars, has left us with blurred lines about what is a state responsibility, regardless of the availability of federal funds. We are continuing to struggle with that dependency. Our recent experience with the federal shutdown put a spotlight on those concerns. The Department of Health and Human Services receives many federal grants, federal resources. Prior to the compromise being negotiated, we were poised to send out letters to hundreds and hundreds of providers, explaining to them we had no additional funds to support their services. It's imperative that we understand how secure any promise of federal funds will be in the future. It is also, as I said earlier, hard to imagine that in a federal budget debate that one of your largest cost drivers in your federal budget is going to be exempt from those debates. Even if federal dollars are stable and they are able to deliver on their promise of extra money up front, expansion still comes at a high cost to Maine. In the short term, Maine will need to hire new staff. Today, our eligibility staff have caseloads in excess of 1,000 cases on average. We cannot add 70,000 new individuals to the program without adding many additional eligibility staff. Even more concerning is that in just a few years, as soon as the 2018 budget, costs will be more than $100 million. This cost would continue to grow and be more than $150 million in each subsequent budget. These are general fund costs, state costs. Maine can't afford this type of cost. It will break an already fragile system. And as I described earlier, it calls into question the state's ability to continue to focus on our challenges and the priorities we know that are most closely aligned with the mission of this program. I want to share with you who we're really talking about as we describe these priority populations, our most vulnerable. While the cost in dollars is concerning, it is even more alarming as we think about our ability to serve our most vulnerable citizens in our state. The governor is committed to building a program that prioritizes our elderly and our disabled. If you remember nothing else from my remarks, I want you to focus on this chart. These are individuals, our elderly, people with intellectual and developmental disabilities, people with physical disabilities, who are on wait lists to receive home and community-based services. What you can see on the slide is certainly the total cost, but Maine's share to address the thousands of individuals who want to be able to stay in their home. I'm going to give you an example. It's always challenging to really paint the picture of who we're talking about. You have family members and neighbors who are challenged by this. Think about, and I've met these families, 75-year-old parents with a 50-year-old developmentally disabled son who's now experiencing dementia, is becoming combative, and they can't access resources to help support their son. These are the priorities that have to be part of the equation as we look at ensuring that our resources are here today, but even more importantly, as we look at the future demand, the number of children diagnosed with autism and what our system needs to be prepared to meet and the costs associated with that. We get the calls from the scared parent whose child is about to graduate from school, from a robust system of services in school, knowing that they're going on the adult wait list. This is where the governor is asking that we focus our attention before we add tens of thousands of additional individuals onto the program. We've got to not only create a stable financial foundation, but we've got to build this program to be prepared to meet these demands in the future. I appreciate the opportunity to be here today, and I look forward to answering your questions. Thank you. And there are none.
Commissioner, thanks for coming down and presenting the significant challenges your department faces. My name is Ed Suslovic. I'm a Portland City Councilor and Chair of the Council's Committee on Public Safety, Health, and Human Services. My question to you is really regarding the relationship between your department as the largest provider of social services in the state and the City of Portland, which arguably is the second largest provider of social services in the state. Recently, especially regarding the potential relocation of your district office, I feel like our relationship is more akin to the Portland Pirates and the Civic Center than a more collaborative relationship, which I think all of us agree is needed to deal with these challenges and make sure that not only the services are provided, but we're spending the dollars efficiently. I appreciate your comments on perhaps how we can improve the relationship between two very significant players in terms of making sure our most neediest citizens are taken care of and doing so efficiently. Thanks.
Thank you. Let me, I thought I might hear about the district office today. So, first of all, I had contacted Mayor Brennan early on to alert him to our lease and that it was expiring. We did work with folks in the city office to evaluate what options might exist. This was prior to a decision ultimately that we needed to go out to RFP, and of course that is a process governed by the state through the Department of Administration and Financial Services. So what we are dealing with now, of course, is the result of that RFP process. From my perspective, what we were looking to achieve if we were going out to an RFP is that we wanted to be able to create a location where we co-located with the Department of Labor. As I mentioned, we've been working very closely with the Department of Labor, the Adult Ed program, but in particular wanted to see an opportunity to co-locate with the career centers. The folks that we are serving, we want to be able to both identify their career pathway and support efficient access to the resources through the Career Center. That clearly is part of our vision for this office space. Let me also address your other point, though, about being an effective partner with the City of Portland. We've created regional teams throughout the state that is intended to create that community-based approach to the services that are needed. And as I've said, the folks that we are serving need both medical services, but also social supports, social resources. We've been inspired by a gentleman out of Camden, New Jersey, Dr. Jeffrey Brenner. He's been focused on, the New Yorker wrote an article about him a couple of years ago, and it's about his work in forming community-based coalitions that have that individualized approach to some of our most neediest people that are high utilizers of the system, but it is founded upon a community-based approach. We've been working closely in the creation and establishment of those regional organizations so that we can be effective community-based partners.
I have a question, Madam Secretary. I'm a student at Southern Maine Community College, and I'm also a veteran of the Iraq War. And I've been rendered ineligible to, my wife and I have been rendered ineligible for Maine care due to the fact that I received certain compensations for wounds that I sustained in Iraq. And I was wondering, I understand that it's your administration is struggling to disseminate care to many people, but I was wondering why I'm having that issue. Thank you.
Thank you for your service, first of all. One of the programs that we've had underway is to better work with the Veterans Administration to look at where we can align our resources. It is certainly a challenge as we look at our limited budget, our limited resources, how we can both provide critical supports to priority populations, but also to look at ways in which to creatively partner. We've been working to identify veterans' benefits that people have not been able to take advantage of, to educate, to partner with the Veterans Administration. We've also been working to partner with TOGAS on how, again, we can better support one another in meeting those services. We need to be a resource on what other coverage options exist, and the department is prepared to do that. There are painful decisions and challenges ahead, and there have been painful decisions made to try and live within our means and best ensure that our resources are aligned with our mission.
Great. That's all the time we have for questions.
Thank you.
Thank you, Commissioner. We appreciate your remarks. We learned a lot more about the department and we'll remember about the waiting lists, which is the thing you wanted us to remember. As a thank you for speaking today, we will be making a donation in the Commissioner's honor to Camp Susan Curtis. It's our pleasure to do that. Some final announcements as we wrap up. You can stay up to date on everything related to the Chamber by connecting via Facebook, LinkedIn, and Twitter. Stay tuned to the Chamber's YouTube page for video of this morning's Eggs and Issues. And as always, the photos taken here this morning will be available for viewing on Facebook and Flickr. Thank you for joining us this morning. For those of you who parked at the Holiday Inn parking lot today, please get your validation ticket at the Chamber registration table. We hope to see you again on January 8th, 2014, when we will welcome John Welch, Chairman of the Maine Public Utilities Commission, as our speaker. Have a very happy holiday season, and we'll see you next month.